Hi, everybody. Thank you so much for attending today. We're so excited to have this presentation. Janille Miranda is a current PGY1 pharmacy resident at Stanford in the Ambulatory Care Track. She went to UCSF School of Pharmacy. She's completed her advanced practice rotations in Fresno and Visalia, California, where she worked with primary care clinics, helping manage diabetes and hypertension. So you all are in for such a treat. She has so much great information and also has some really great areas in which to make this presentation interactive. So feel free to use the chat, as well as if you have questions, we're going to hold them to the very end, and I will ask them all. And so you can add them into the Q&A at the bottom of the screen. So thank you all for being here. And without further ado, you can take it away.
Thank you so much, Leah. Can you hear me? Okay, great. So again, my name is Janille. I'm really excited to give today's presentation talk on medication cost savings. And let's just get right into it. Okay, so for today's presentation, we're actually going to talk about some different subjects, including lowering drug costs. So we'll also define medication adherence today and find out why it's important for diabetes health. We will also distinguish the differences and similarities between brand and generic drugs. And we will understand all the resources available that can help lower our medication costs. And tying into that, lastly, we will identify the different criteria and different services offered by Medicare, as well as learn important insurance terms. Okay. So in this slide, I just want everyone to have a visual representation of the different diabetes medications that we have available in the market. So some of you may be familiar with some of these medications as you may be on it, but we can see a wide range of variety, including oral medications such as metformin or Jardiance or glipizide. And on the other spectrum, we also have our injectable diabetes medications, including Ozempic, on the left over here, and some insulin products as well, such as Lantus. So as you can see, diabetes medications are very diverse and there's a lot of variety, some of these being older medications and some of them being newer medications. And so moving into our medication adherence slide, so I wanted to define this term with everyone. The definition of medication adherence is the extent to which patients are able to take their medications as prescribed by their provider. And so as providers and healthcare professionals, our goal is to have our patients take greater than 80% of their medications as prescribed. And that would categorize them as being medication adherent. So let's look into some statistics about medication adherence in the diabetes population. The adherence rate in the diabetes population actually ranges between 36 to 93%. Within that population group, those on insulin have an adherence of around 63%. So whether you have diabetes or are getting insulin or taking insulin, there is a range and there's some room for improvement in terms of medication adherence. All right, and so you may be wondering why is medication adherence important? What are the benefits? So let's look into that. So all the medications that I've previously shown in the slide, in a couple slides before, they have all been studied in large clinical trials and have been shown to be efficacious and also safe in improving your glucose control. And so we know that through these trials, these improvements in our sugar in our body leads to the prevention of complications down the line, prevents diabetes progression, and leads to a better prognosis in your health. So the studies have shown that taking medications every day as prescribed, or however they are prescribed, it reduces your hospitalization frequency. So the amount of times you are hospitalized. And also, it actually saves you money in the long run. So it's going to reduce costs in the long run associated with these complications. So as a reminder, on the wheel on the right is going to show the different complications that can arise when our diabetes is uncontrolled or unmanaged. So that means when our blood sugar levels are elevated for a prolonged period of time. That can lead to complications in different organs in our bodies. So in this wheel, we actually have some examples of what can occur, such as a heart attack or stroke, but also different eye conditions such as glaucoma or cataracts, as well as damage to the kidneys or damage to the nerves, resulting in something called peripheral neuropathy. Okay, so let's look into what can hinder our adherence or what are barriers to our adherence. So in this slide, we have different examples of barriers to medication adherence. The first one that we see is cost, which we'll talk about today, and hopefully everyone can learn new ways to reduce our costs in our medications. But other things that might be more common, because we're all human, and with taking medications and sometimes multiple medications, it's hard to remember when to take them or how to take them. Also, some people might be fearful or maybe are unaware of the side effects or kind of uneasy about taking a medication because they fear the side effects. And other things can be travel and transport. For example, if you're traveling for a long period of time and you maybe forget to ask the pharmacy to give you a month's supply of your medication and you run out during your travels. And number of medications can also affect the adherence. Thankfully, we have a lot of solutions for these barriers. So in this chart, I just wanted to show on the left the barriers to adherence, and on the right, some solutions if you want to improve your adherence. So I'll just touch upon some of these, but in your own time, you can take a look and read through each of the solutions. So for example, starting with education, let's say you want to find out if you're taking your medication correctly. Do I need to take it with food? Do I need to take it in the morning or in the evening, or time it a certain time before eating a meal? All these questions are really great for your local pharmacist. And actually, the pharmacist has been known to, it's kind of has a definition as being the most accessible healthcare provider in your community, because you can actually go to your local pharmacist at your local pharmacy. And since we are the drug experts, we know the clinical trials, we know how the medication is best taken and the side effects. So we can really educate and inform you if you're uneasy about a medication or maybe have more questions about its safety. Another thing you can do is ask for a referral from your provider for a diabetes education class if interested. At Stanford, we offer diabetes education classes. You can also ask for a referral for a dietitian if you want, or a pharmacist. The pharmacists here have been working for many years with people with diabetes. And another solution would be to possibly join a study for extra support if you're a person that wants extra support and extra one-on-one attention. I will talk about one later on. If you are wanting to improve your adherence and you notice that you've been having missed doses or want to help a family member or friend that's missing their doses, some solutions would be, examples would be some phone or app reminders. Some of them I have listed shown on the right over here. They include Pillow, and the other app is MediSafe Pill Reminder, which can connect to your iPhone and also your Apple Watch. And other options for solutions here are using a pill organizer or even a bubble pack, which is the photo at the top right over here. These bubble packs you can actually make yourself. They're essentially pouches where you can put all your pills in for the day and then seal it back up, and then just take one pack each day as you go. So you can actually purchase these on Amazon and make your own bubble pack. And that might be an easy way to remember to take all your medications. But I will say that this would be more recommended if you are on a stable medication regimen. Whereas if you're constantly seeing a provider or more frequently, maybe in the beginning of your visits with a provider, they might be adjusting your medication, and this might not be the best option. All right, move on to the next. Okay, so in this slide, I just wanted to show one study that's available at Stanford, where it's available people with type 2 diabetes who might want that extra support that I was talking about. This study offers, they may offer a continuous glucose monitor, which I'll talk about later, which is a way to closely monitor your blood glucose levels throughout the day instead of pricking your finger every day. They can also offer virtual group classes and one-on-one weight loss sessions. And it's just a way, if you feel that you need a little more extra support in the beginning or some help with adherence, this might be a good option. So this QR code right here, you can use your phone to go in and see if you're eligible or see if you want more information about it. And then on the right over here, we have Project Health, which is specifically for people with pre-diabetes, with diagnosed pre-diabetes, which is also an option. Okay, so I did want to say that throughout my presentation, I'm going to have some little quiz questions, which are, we just ask that you put in the chat the answer that you think is right. And these are just to check your understanding of the objectives, to make sure that we're understanding what I'm presenting. So the first question is, medication adherence will help me, A, save costs in the long run, B, decrease hospitalizations, C, prevent diabetes progression, or D, all of the above. Okay, so
I have a lot of D's.
Yes, yeah, great. So
all
we have
of the above.
Awesome. It seems like everyone's catching on. So great. So yes, the answer is D, all of the above. Good job. Okay, so moving on to our next objective. Now we're going to define brand versus generic. Okay. So brand versus generic drugs. So let's start with defining a brand drug. A brand drug is a drug that is developed by a pharmaceutical company and contains a patent for a number of years. What I mean by patent is that the pharmaceutical company has the right to develop this drug for a certain number of years and sell it at their price that they designate. So typically a patent is around 20 years or so. After which that patent runs out or expires, then other companies can develop the same drug or a similar drug. But there is a federal law requirement for this drug to be made. So we call this the generic drug. All right, so federal law requires generic drugs to be chemically identical to the FDA approved brand name drug. And what I mean by chemically identical is that the generic and the brand drug will have the same active ingredients. They will have the same effectiveness in the body and the same dosage form, strength, as well as the indication or the reason, the condition for which it is used, as well as quality and safety. The second main takeaway from this slide is that generic drugs are going to cost around 80 to 85% less compared to the brand name drug. Okay, so here's sort of another overview, another visual to compare both brand versus generic drugs. And in the middle of this visual, we have characteristics. So starting with the first characteristics, I mentioned active ingredient. This is going to be the same in both the brand drug and the generic drug. And then when we look at dose strength, it's going to also be the same for brand and generic drug. They're going to have the same dosage strength available. For FDA approval, this is a little tricky, but I did want to explain it a little bit more. The brand drug, since it is developed by the pharmaceutical company spends a lot of money on making sure the brand drug is safe and effective since they're developing it from scratch. And so they have to go through rounds of clinical trials, typically 3 or more phases. We divide these trials into phases so that we are very sure that the drug is effective and safe in patients. Whereas the generic drug is going to also be approved by the FDA. However, they're using the same active ingredient since the drug has already been developed by the pharmaceutical company. But the generic drug, the companies that make it are going to have to submit similar and show similar safety and efficacy and submit that application to the FDA to make sure that it's equally effective and safe compared to brand. Let's see. Cost, the brand is going to be higher cost, and then generic drug is going to have a lower cost. And for insurance, typically the generic drugs are generally covered by insurance, and then the brand drugs, it will depend on the insurance plan and the insurance formulary, which I'll talk about later. And then just as an example, on the right over here, we have a photo of Tylenol on the right, which is $10.59, versus in the middle here, we have acetaminophen, which is the generic name or the generic drug, and that is $1.99. Okay, so let's check our understanding again. So this time we have a true and false question. True or false, brand medications are more effective than generic medications. A is true, B is false. And for the second question, generic and brand medications have the same A, active ingredient, B, cost, C, strength, D, dose form. I will say for the second question, there are multiple answers. So let's see here. So I see a couple B's for one, and that is correct, I will say. Yes, it is false because brand medications are equally effective as generic medications. So generic medications are not less effective. They are equally as effective as brand medications. And two, we have yes. Mm-hmm. So yeah, so for number two, it's A, C, and D. Okay, so the only thing that is not the same is cost. The generic drug is going to be less cost than the brand drug, but they will have the same active ingredient. The strength is going to be the same in both, so the same dosage. The form also has to be the same. So if it's an oral drug, it's going to, as a brand medication, it will have to be if it's an oral tablet, for example, in a brand medication, it will be an oral tablet in the generic form too. Great. All right. Okay. So you guys are doing a great job. So we're going to go ahead and move on to one of the most important part of the presentation, which is lowering drug costs. All right. So let's start with learning about copay cards. Copay cards are offered by drug manufacturers, also known as pharmaceutical companies, in order to reduce the brand name drug costs. It's not going to reduce all the cost of the brand name drug, but it's going to help offset some of the costs. The way that you enroll for these copay cards are either online or by calling a phone number. You will have to go to the website of the brand name drug, and you can find information about how to enroll and call. Essentially, once you enroll and call, they will ask you things like your name, your address, your phone number, which medication you need, either if you have insurance or why you need to take it. But it's actually a very simple way to sign up online. Once you go through that process, you print out the card. They will give you a card and you will bring it to the pharmacy, and the pharmacy will take the card and apply it for the cost of the medication. Some important requirements for a copay card are that you must have commercial or private drug insurance. And an important exclusion is that they do not accept governmental health insurance. For example, Medicare. If you have Medicare, they will copay cards will not accept Medicare. So this is only for people that have commercial or private drug insurance. So as an example, on the right, we have one of the medications that offer copay cards is Ozempic. Ozempic is that once weekly injectable for diabetes. And so if you go to the website for Ozempic, you can find information about how to enroll, and they can help. They have a copay card available. Okay. Moving on to patient assistant programs, or PAPS. Patient assistant programs are a financial assistance intended for patients or people with no insurance or underinsured or low-income patients. So these unique patient assistant programs, they can provide actually the full cost of the medication or a very, very large discount. They are primarily sponsored by the pharmaceutical companies themselves. Some requirements for patient assistant programs include being a permanent legal resident of the US or US territories, providing proof of being underinsured or having no insurance, as well as meeting the unique income eligibility requirements. I will say that for some of these patient assistant programs, they require an income of less than 400% of the federal income limit. I can also confirm that later on, but I would suggest, if you are interested in patient assistant programs, going to the actual manufacturer. For example, for Ozempic, the actual manufacturer website is Novo Nordisk. So if you go on the website for Ozempic, they're not going to advertise or show information about patient assistant programs. But if you go to Novo Nordisk website, they will have information about how to apply. Same with medication called Jardiance. If you go to the Jardiance website, they don't have the information. You will need to go to Boehringer Ingelheim, which is the actual manufacturer website, and they will have information about how to enroll. And just to reiterate, each patient assistant program is unique in their income eligibility requirements. On the right over here, we just have a little screenshot of how the patient assistant program application looks like. Essentially, it could be 2 pages of information, and you may require a provider signature. So just keep that in mind. Okay. Another interesting resource that we have available in the Santa Clara County is Better Health Pharmacy. It is part of Santa Clara County Public Health. It is unique because it is a drug donation pharmacy, which receives unused, unopened medication donations from other pharmacies. It is available for all patients, regardless of immigration status. It's open to all patients with a valid prescription. They offer drugs at no cost, no copay, but they do not offer controlled drugs or controlled medications. What I will say about this pharmacy is that to make sure that since they are a drug donation pharmacy, their inventory may not always be up to date. They might not have the drugs that you are looking for. So I would double check on the website linked down here and check out to see if, and give them a call or check out to see if they have the medication that you require. I did paste down a screenshot of some of the diabetes medications and supplies that they have available, but I will always double check before going and seeing if they have the appropriate inventory or stock of the medication you're looking for. Additional services at this pharmacy include free COVID-19 tests and flu shots. Okay. All right. And moving on to another drug lowering cost option, you probably have heard of GoodRx from commercials or websites or ads on the internet. So GoodRx is a free mobile app and website. No sign up is needed for GoodRx. Anyone can really go on the website and download these discount coupon cards, which you can use at the pharmacy. The only drawback about GoodRx is that you cannot use it with your insurance or in combination with your insurance. So it will actually replace insurance. Essentially, it will help offset costs if you are paying in essentially cash or without insurance. They do advertise that savings can go up to 80% on brand and generic FDA-approved drugs. However, I would check the website and place in the medication that you're looking for. So quickly, I actually took a screenshot. I was typing in Jardiance. I know that Jardiance is a brand drug. Right now, it currently does not have a generic equivalent. So I know that it's going to be expensive. When I looked it up, it only offsets the cost of just like a little over $100. And it's still, quite expensive. So in my recommendation, I would not use GoodRx for brand drugs that you're looking for. It can help with mostly generic drugs or over-the-counter medications that you're looking for. It can help you save money there. For example, if you know someone that's trying to quit smoking or needs help quitting smoking, GoodRx can help pay for something we call nicotinic replacement therapy, which is going to help with cravings of nicotine. And so this might be a good option for these patients, as well as any over-the-counter medications you may need. And this is actually new for me. I learned a lot about when I was making this presentation about Mark Cuban's Cost Plus Drug Company, or MCC-PDC. It was recently launched in January 2022. And as of December 2023, just a month ago, or a couple months ago now, they have increased their inventory to include up to 2,200 drugs. They only make or provide generic drugs. So essentially, the idea of this company is to eliminate the middleman in the pharmaceutical drug industry, I would say. So there typically is a middleman, which is part of the industry, but this company eliminates that middleman, and they are actually very transparent about their prices. So on the website, you go and you can look up the medication. They will provide a fully disclosed price of the medication. Plus, they add a 15% markup. Plus, they add a $5 pharmacy service fee, plus a $5 shipping fee. So this is a mail order, a pharmacy essentially, and they ship to all 50 states in the US. They do use accredited pharmacists to fill their prescriptions. And more of the whole list of diabetes medications will be available in the homepage. Again, I do want to say that at the moment, they only have generic drugs available that are diabetes medications that are generic drugs. So if you're already getting generic drugs at an affordable price at your local pharmacy, I would say this might not be recommended at this time. But maybe keep an eye out for this. They might be adding more medications in the future. But at the moment, they only have generic drugs. Okay, so we've reached another check your understanding. This time we have 3 drugs, so I'll just go in order. So number 1, true or false question. You must have commercial insurance to use copay cards. True or false? True or false? Yeah. So it's actually true. So you do need to have commercial insurance to use copay cards. You cannot, for copay cards, you cannot have Medicare or federal health insurance. That's the only exclusion. Okay, so they do require you to have a commercial insurance or private insurance. Number 2 is patient assistance programs are intended for A, underinsured, B, people with no insurance, C, low income, or D, all of the above? Yes, 2 looks like I have a lot of D's. Yes, so 2 is D, all of the above. And lastly, number 3, we have true or false. Better Health Pharmacy provides medications to customers free of charge. Is it A, true, or B, false? Yes, that is true. So going to this pharmacy you will pay no cost to the medications. It will be free of charge. Great, you guys are doing so great. All right, and now we're moving on to one of our last objectives. We'll talk about Medicare in detail. But before I go into Medicare and the different parts of Medicare, I wanted to go over some terms that will be really important and good for everyone to know, and especially if you're planning on signing up for Medicare or signing up for any insurance plan in this new year or planning on switching insurance plans. Okay, so the first definition is deductible. Deductible is the set amount that you need to pay for before your insurance plan starts paying for your medical services. So this can be an arbitrary number, for example, $500 or $1,000. So when you sign up for your insurance plan, you need to pay the full price of this deductible until after you reach that number that you pay, then the insurance plan will start paying for your medical services. Next, we have coinsurance, and coinsurance is a little tricky to understand as it can get confused with copay, but coinsurance is the amount that you may be required to pay as your share of the cost for services. This is after you pay any deductible. So it's typically a percentage so let's say you're done paying your deductible, your insurance starts paying for your services, but when you go to get these services, after the visit or after the service, you will get paid, and from that bill, it's a percentage of the service that you received. Again, different plans will have these specific amount of coinsurance or deductible, so it's very important to read everything about the plan before. And lastly, we have copay, which may be more familiar about. Copays are the set rate that one pays for services such as provider visits, prescriptions, and other care services, but it's paid upfront before you get the service. Okay. Okay, so now that we know that, we can go into learning more about Medicare. So what is Medicare? So Medicare is a federal health insurance available for people age 65 and above, and or people with certain medical conditions. For example, people with end-stage renal disease or ESRD, or people with a disability for at least 24 months may be eligible or will be eligible for Medicare. And then Medicare is broken down into different parts, Part A, B, C, and D. And so I'll just focus on these parts for this presentation. Starting with Part A is hospital insurance. It's going to cover your hospital stays and inpatient care stays. And then whereas Part B, this is typically what we know as medical insurance. It's going to help pay for doctor visits and outpatient care. I'll go into more detail about Medicare Part B in the later slides, especially in terms of people with diabetes and how it can help pay for costs there. And then moving on to Part C, we call this typically Medicare Advantage plans. And the Part C is essentially private plans that are offering a combination of Part A, Part B, sometimes Part D, which I'll talk about. And these plans also provide additional benefits that are not in Part A or Part B. So some of these additional benefits will be vision or dental or even hearing services or other extra services. So Part C is a unique private plan which incorporates many other additional services. And then Part D itself is solely drug coverage, so prescription drug coverage. Okay. So since we're learning about lowering drug costs, I wanted to focus a lot on Medicare Part D, so our prescription drug coverage. So how can you get Medicare Part D? So in order to get Medicare Part D, you must already have a Medicare Part A and or Medicare Part B enrolled. Or you may have Medicare Part C, which is a Medicare Advantage plan that offers the Part D coverage. So it is best to enroll for Medicare Part D when you first sign up for Medicare. What I mean by this is that if you do not sign up for Medicare Part D at the beginning of signing up for your Medicare Part A or Part B, you may have to pay a penalty if you decide to enroll in Medicare Part D later on in the year. And in fact, if you continue to delay the process of enrolling for Medicare Part D, each year it's going to keep accruing and the penalty is going to rise. So that's sort of an incentive for people that are considering Medicare to definitely sign up for Medicare Part D at the very beginning when you're starting to sign up for Medicare plans. Again, it's going to help pay prescription drugs, and I will talk about the different things that it will cover, but a summary is that it's going to cover your diabetes medications, including insulin. It also covers vaccines that may not be covered by Part B. Okay. And then moving on, this is a very important slide as we're talking about Medicare Part D. So there is different phases throughout the year of Medicare Part D, starting with the first phase being your annual deductible. So at the very beginning of the year, when you first get your insurance, you will begin to start paying your annual deductible with your first prescription of the year. So you're going to cover the full cost of prescriptions in the beginning of the year because you're paying your deductible. After which you move on to phase 2, where this is called the initial coverage phase, where you've already finished paying your deductible, and so now your insurance plan is going to start paying for your drug coverage. Okay. And then that's going to last for some time until what we call the coverage gap. You may have heard this as another term called the donut hole. So this coverage gap is when your plan has already spent around $5,000 on your covered drugs. And at this point, the person has entered into the donut hole or coverage gap where you will now have to pay out of pocket for your prescription drugs. And next, the last phase is called catastrophic coverage, or phase 4, catastrophic coverage, which means that your total out-of-pocket costs have reached around $8,000. And at this point, you exit the coverage gap, and now your plan is going to pay full coverage for you until the very end of the year. I did want to mention that there is a new law that has passed, and hopefully we will see these changes in 2025, but they are trying to eliminate this coverage gap in 2025. Okay. All right, so let's learn a little bit more about what is covered under Medicare Part D. So Medicare Part D is going to cover insulin. So if you're on insulin, Medicare Part D will cover it. They will also cover any supplies that you need for insulin use, including syringes, gauze, and alcohol swabs. For Medicare Part B in particular, they will cover insulin if you are using an insulin pump. And they will also cover all diabetes supplies, which I'll talk about later. And in this chart over here, I did want to mention that Medicare has a nice rule in which the cost of 1 month's supply of insulin is going to be capped at $35. So if your provider is ordering a 30-day supply of insulin, you will only have to pay $35. There is no deductible payment for insulin. And even if you get a 3-month supply of your insulin, the same cap is applied for each month. However, I did want to mention that if sometimes providers aren't able to give you an exact 30-day supply of insulin because of the way that the insulin pens are dispensed in a number of pens in a box. They might not make it to exactly 30. They might give you a 45-day supply. At that point, you will be prorated. If it's more than a 30-day supply it will be prorated for your copay. So just in case you see more of a cost, that is the reason why it's a little bit more. Okay. All right. And so now let's look into Medicare Part B and everything that it covers. So I think this is a really nice slide which shows everything that Medicare Part B covers, including glucose monitors, blood sugar test strips, Lancets, and insulin pumps. So in this photo over here, we have an example of AccuCheck, which is we call it a glucose monitor, glucometer, or finger stick device where you can check your blood sugar. And Medicare is going to cover all of this. Continuous glucose monitors are also going to be covered by Medicare. So anyone that is on insulin or anyone diagnosed with diabetes who was seen within 6 months are able to get a continuous glucose monitor, which looks like this sensor at the top. It can be as small as a quarter or a nickel, which you place on your arm and connect it to your smartphone in order to see your blood sugar levels throughout the day. Other people that can obtain a continuous glucose monitor include people that have documented hypoglycemia or severely low blood sugar. In addition, Medicare Part B will also cover your annual flu or pneumococcal vaccines, foot exams, and eye exams if you are at high risk. Okay. And if Medicare isn't able to cover all of your costs, even with your Medicare plan, there is another option called Extra Help Medicare, which is intended for people with limited income and resources. It will help pay for Medicare Part D monthly premium, any yearly deductible, your coinsurance, and co-payments. You can easily apply online or by calling Social Security at the number listed. And I did want to show just a screenshot of some of the income and resource limits as of 2024, and that if you do qualify, these are the limits to look out for. There is a little pop-up over here which mentions what counts in resource limits in the individual or married couple. So essentially what counts in resource limits is the money in your checking, savings, or retirement account and your stocks and bonds. And just as an example, you can actually see this example on the website. For example, Jardiance, we know that it's a brand name drug. It is expensive. And so Part D patients typically pay between $0 to $50 for a month's supply of Jardiance. So with Extra Help, the Jardiance coverage is an average cost of between $4 to $10 a month. Okay. And then moving on to a couple other terms, just two more terms I wanted to share with you all. Formulary and tiers are very important to know, especially when you are switching insurance plans or deciding on an insurance plan. This is important to know. So what is a formulary? A formulary is a list of prescription drugs that your insurance will pay for. So each insurance plan is going to have its own unique formulary. And within that formulary, we have something called tiers. And so the drugs listed in the formulary are going to be ranked in different tiers. And this tells the insurance company what they will cover first, which drugs are, for example, the drugs in the lower tiers, tier 1 or tier 2, these may be covered by the insurance, and the drugs that are in tiers 3, 4, and up will have a harder time. It will be harder for your insurance to cover those drugs. Let's say, for example, your insurance tells you that their tier 1 drugs are the generic drugs. So these are the more affordable ones, which will be covered by your insurance. But then they tell you that the tier 2 drugs are going to be the preferred brand name drug. They will cost more than tier 1 drugs or generic drugs, but they will cost less than the tier 3 drugs. And tier 3, for example, it will be the non-preferred brand name drugs. So the higher the tier, the more expensive the medication or drug is going to be. Okay. So why is this important to know? Knowing that each insurance has its own formulary and tiers means that knowing your prescription may cost more or less based on if it is on the insurance formulary or based on what tier it is in. So what would you do if your prescription is a brand name medication and it's expensive? What is something that you can do? Okay, so one thing you can do is call your insurance and see if there is any drug in the same class that is on their formulary and that may be covered by that insurance. So always ask and see if the medication, if there's an alternative or a substitute for this medication in the formulary of your insurance. So it might just be that the insurance formulary doesn't have that drug listed, but they may have another one that is in the same class and that is covered by it. Okay, so that is essentially my presentation. In summary, we talked about several things. In the beginning, we talked about how it's important to be adherent to medications in order to prevent diabetes complications down the line and progression of diabetes. We also learned about the differences between our brand and generic drug medications and what can save you money. And also the several resources available to lower drug costs. And finally, we touched upon the different Medicare parts and ways that Medicare can help pay for drug costs. And thank you so much for listening to this presentation. I did have a link to cost-saving resources, but I unfortunately can't paste it in here. So we'll try to post it when we post this video on the website. Thank you so much. I'm open to questions.
Thank you so much. What a wonderful presentation. I also learned so much. Someone was asking if you would be willing to post your presentation with the recording.
Yeah, I'm open to that. We can definitely post that for other viewers. Yes.
Okay, so that this presentation and recording will probably be posted in on the Health Library website in the link that I provided in the chat. And then the questions. So somebody is asking, can Bubble Pack be found at stores like CVS or Walgreens?
Oh, that is a good question. I would have to check in. I would check in with the pharmacy themselves. I'm not sure if every CVS or every Walgreens has that option available. I know that private pharmacies, if certain companies online will do that for patients, but I'm not entirely sure if Walgreens and CVS. I would just check in with your local pharmacy and see if they're able to do that. Yeah.
Okay, great. So this person's asking, wouldn't everyone buy generic if it was lower cost? And why would providers require a patient to take a brand name drug?
That's a great question because when I first started my education, I was thinking the same thing. But I did want to say that as I mentioned this in one of the earlier slides, brand name drugs, they have a patent for a number of years. It's about 20 years. And during those 20 years, only the pharmaceutical company is allowed to develop and distribute and sell the brand name medication. That means that there is no generic available at the moment. For example, Jardiance, that's one of medication that's only brand name available. It has shown great data on helping prevent kidney dysfunction, which is just damage to the kidneys, especially in people with diabetes, with advanced diabetes. It has shown great data to protect the heart in people with diabetes. And for this reason, a lot of physicians, providers, health professionals, we like this medication. We have seen the data, we know it's good, and so we may prescribe it to people with diabetes, especially to protect the kidney and the heart. But unfortunately, at the moment, we don't have a generic available for that class of medication. And so we will just need to wait And the good thing is there's a lot of older medications in for diabetes, such as metformin or glipizide, that are all generic. So a lot of diabetes medications are generic, but unfortunately, the newer ones that have come out in the recent years, we don't have a generic equivalent for them.
That was a great answer. Super thorough. And then somebody is asking, do you have to live in Santa Clara County to use the Better Health Pharmacy?
So I was looking that up myself the other day because I was also wondering the same thing. It wasn't evident from their website, but I know I have a patient that uses it, but I will have to double check and see. Right now I wasn't able to find that information, but yeah, I would have to check, give them a call and see. But from what I researched, and it looked like it was open to all patients, and but I will have to check about that. Sorry about that.
Okay. And then I think that people had just kind of some other very specific questions, but it sounds like you kind of answered them. Does anyone have any last questions that they want to submit? Somebody wants to know if they can decline Part D.
Yes, you can decline Part D. There's certain restrictions, there's certain circumstances where you will have, there's special circumstances, and if you go online on the website, they will show, there's certain circumstances where you can decline it, but if that's, the question itself, yes, you can.
Okay, they were saying it sounded like they might be penalized. And then somebody is also asking, I don't know if you know this, but is Ozempic covered by Medicare?
That's a great question. I, off the top of my head, since I don't submit I work closely with pharm techs, and they might have better idea of what is covered by Medicare. And it will depend on your insurance plan with Medicare. But if you go online on the website, you can look up the plan that you have and if it is on their formulary. So like we talked about, always good to just double check, call the insurance company and ask if they have Ozempic on their formulary.
Great. That's actually a great answer. So it kind of goes back to what you were talking about in your presentation, that when you're not sure, because things do get really complicated, there's so many other plans, that just to call the insurance plan that you have and ask them if it's on formulary. You taught us so many wonderful words today and terms so that we can all speak the correct lingo, which I'm sure is very important when we're talking to these people. So I don't see any other questions. So thank you so much. We really appreciate your time. And we will post this recording as well as the presentation on the Health Library website under the diabetes education. So thank you all. Hope you have a wonderful night. Bye.
Thank you. Bye.